Helo, Dylan Roberts ydw i. Fi yw'r prif swyddog digigol a gwybodaeth o Betsi Cadwaladr ac hefyd yn cadeirydd y grŵp reit newydd digigol, data a thechnoleg dros Gogledd Cymru. Be ydyn ni'n ceisio wneud ydy uno pethau hefo'i gilydd i wneud y pethau yn well i'r staff ni a'r pobl da ni'n gwasanaethu. My name's Dylan Roberts. I'm the Chief Digital and Information Officer from Betsi Cadwaladr University Health Board. I'm also the chair of the new, or rather new, Digital Data and Technology Group across North Wales, which is trying to join things up to provide a better experience for our staff working across the health and care system, and also hopefully better solutions and services for the people that we serve across North Wales. This group fits under the RPB umbrella. You may say it is a subgroup of that, and we report progress into that group. The purpose of this video is to make sure that everyone who gets this from the digital data and technology communities across our local authorities, independent sector, and anyone else actually who's contributing to delivering better healthcare outcomes across North Wales are aware of it. That's the first thing. And if they're not aware of it, to make sure you can get connected to it and understand what's going on. And also to provide an update of the work we're doing. It's really important, I guess, to me and to the group that this is not just another group and a talking shop. We actually get stuff done. So what I want to do is be able to articulate the work streams we're looking at, and hopefully that will strike a chord and will make you think in your organisations this is an important thing for us. And what I want to make sure is that each organisation is playing their part and contributing to this. If we don't do that, then we miss the opportunity, and that's not something that we obviously want to do. So to start with, it's probably worth explaining that so far the group has been made up of a mix really of both directors of social care and deputy directors or heads of service, I think is the case in local authorities, digital data and technology, heads of IT, let's call it, from across every local authority is represented across North Wales. It's also made up of representation from the voluntary sector councils, representation from independent sector, and of course representation from Betsi Cadwaladr. Betsi Cadwaladr isn't necessarily one joined up organisation as it may seem. It's important that there is representation and input, as there has been, from both community, primary care, mental health and the acute sectors which are part of Betsi Cadwaladr. It's important to get that expertise involved, and they are all involved in this. The group has run 3 or so workshops so far. Very important to be clear about what are the areas or work streams that we need to focus on jointly as North Wales to both deliver better value for money and outcomes, but also to hopefully provide a more joined up approach to Welsh Government and organisations such as Digital Health and Care Wales, so we can flex our muscles more around what's important in the context of North Wales and our system when considering national programmes, policies and decisions. The 4 streams that we've come up with, I'll share the screen now very quickly if it will work. So the 4 streams that I've come up with, I will provide this update paper which went to RPB in the email which goes with a link to this video, are getting the basics right, innovation, digital inclusion, and data and integrated health and care records. Just a quick overview of these. You'll see there that the leads. So Di Roberts, who is the head of ICT from Wrexham County Borough, he's leading that piece of work, and he's coordinating that through the heads of ICT group across North Wales. This is about how do we make sure that everyone can get seamless, secure access to systems and information anytime and any place from any health and care setting across North Wales. That could be an independent sector organisation, i.e. a care home, could be a local authority building, or a NHS building. We're very conscious of the fact that there's been various barriers put in place because of that, because of things like IG rules and the like. Those are things that we want to overcome, and that group is looking to sort that out. On a very practical level, in the first instance, they are looking at what's known as Active Directory integration, which will allow people to ultimately log on and access services from any place, and that those logons will enable the ability for them to be audited and the like in terms of what they do. We're also looking at ubiquitous Wi-Fi, of course, which should be a basic human need really in any organisation. And of course, we're looking at things like GovRoam, which I know is prevalent across lots of North Wales, but needs to be ubiquitous across. So those things are being worked up. Another factor is that the group are looking at what is the standard specification for any new builds or fit outs. So in other words, whichever way, whatever happens from a property point of view, whether a local authority, whether or not a health service or whatever, we've got a standard specification or requirement for any property build. This is really important when we think about strategic capital plans, so that the technology is built in by design or really considered as part of those things. As far as the innovation stream is concerned, Hiwanir is leading that from Gwynedd, Cyngor Sir Gwynedd, and that is looking at a joined up approach to digital innovation. It's important that when it comes to innovation, we must start with a definition of the problem to start with. What is the problem that we're trying to solve, to make sure that which we implement actually delivers a proven benefit that can be evaluated, whether it's a left shift issue or whatever it might be in terms of the health and care system. It's very important that we do that discovery and design with people, with citizens in particular, or patients, whatever they might be, in advance, to make sure these types of solutions are right. We're worried about the fact that we've had lots of pilots and we've had lots of tech for tech's sake, as opposed to really looking to solve the problems. However, as part of that, working with Alison Kemp from the central part of BCU, who will be working on behalf of the whole, we are looking to work with Tech Cymru to develop cases around telecare and possibly virtual wards and the like. That's the area of focus we've decided to look at in the first instance, being really keen not to spread too thin and really focus on something that we might be able to deliver. On all these things, including getting the basics right, bear in mind the task is to develop business cases around these things. So it's important that the scope is narrow and the benefits are clear. Digital inclusion is absolutely critical, and Dewi Smith will be leading on that approach. It's really important there's a joined up approach to this, because we need to maximise the use of resources across North Wales to deliver better outcomes here. Just because we're trying to do things in a joined up way, it doesn't mean it's a one size fits all. It might be that in some of these instances there are 30 or 40 type of projects or whatever going on across North Wales, and that's fine. I think the point is here, what can we reuse, what assets can we reuse, what money can we reuse. The more coordinated we are, we think the better use of public funds that we can make, and of course we can capture the great work that's happening in local context, accepting the fact that no one place is the same as the other, and in some cases there's a different means of delivering in those different contexts and different places. The final one is about integrated health and care records. This is pivoted somewhat. I'm leading on that, Dylan Roberts. It's pivoted in that it's got tied into the WCCIS discussion. Some people may or may not be aware that DHCW have suggested some changes to the WCCIS programme at the national level and made some recommendations to the Minister. What's really important for us from a North Wales perspective is that we can get together, really understand the impact of those things, and come up with some requirements, what we want, what's important to us in our area, and to make sure we're not done too really with something which may not be a fit, recognising the differences across different local authorities and across North Wales. So it's the whole point of all of this is, can we provide a combined voice? Can we support each other on these initiatives? And can we flex our muscles in terms of what we want potentially on at the national level? It is going to include the necessity for some business cases to come forward. Whether or not they will be funded or can be funded, to be determined. But business cases are going to be written, or proposals in the first instance, whether or not it's around innovation, the telecare stuff, whether or not it's about the basics, digital inclusion, or integration. They're the themes we're going to stick to. They're the themes that have been agreed by all parties. Is everyone aware of this? If you're not, please make sure that you connect with the relevant people from your organisation who's involved in this. Natalie Pryor and Sarah Bartlett from Denbighshire are doing a lot of the coordination and PMO work, project management office work, and they are coordinating things. There's also consideration for the strategic capital plan and the need to potentially come up with some ideas of projects we might want to put forward to that and to Welsh Government. So again, opportunity to do things in a joined up way to try and secure some money. I appreciate these things are difficult to do, and that's why your direct contribution to doing some of this work is important if you think it's important. So I hope that helps to provide a very quick overview of some of this work. The RPB are supportive and keen for it to progress. If you want to talk about any aspect of this, please get in touch with either Natalie, Sarah, or myself, Dylan Roberts from Betsy, and we can talk to you about it and try and help to get you connected as appropriate, or make sure that the right people from your organisation are involved in the group and the work that's going forward. Thanks very much for taking the time to listen, and speak to you soon.